Then we discussed pathological condition or disease condition related questions and answers. And again, now we are discussing about pharmacology or medicines related questions and answers. And one more thing, if you are not subscribed to our channel, please subscribe. Don't forget it. And with this video, we will wind this respiratory system. Tomorrow, we will discuss cardiology system, cardiovascular system, pharmacological questions and answers. And then we will discuss a new topic. So, we will start the topic. Before that, everyone, hi, good evening. Thank you for waiting for this video. We will start the topic. Pharmacology, respiratory, that is respiratory system related pharmacology questions and answers. This is the sixth part related to respiratory system. Rahul Chaudhary, Surya, Geeta, Vijayan, Padma Kumari, Vrinda, Soma, Ahmad, Suryadev, Ramveer, Liji. Hi. So we'll go to our topic, that is questions and answers. Before going to start, there is information for you, that is Unacademy started IIT JAM courses. So tomorrow they are starting chemistry batch for IIT JAM batches starting from tomorrow onwards. This chemistry batch is conducted by Anil Saini sir, Alka Rani madam, Yogi Joshi sir, Harshida Khurana, Tarun Chauhan. This is exclusively for IIT JAM batch starting from tomorrow, that is 11th January 2021. And if you are joining with my referral code, you will get 10% discount. And this is low cost only now. And this is best time for joining. That is for IIT JAM batch starting from tomorrow. And same time, IIT JAM physics batch also starting from tomorrow. That is physics batch is handled by Sunil Joshi sir, Amit Ranjan, Kajal Kumawat madam, and Chandrasekhar Boj. These are the previous year toppers, so you will get best exposure in physics topics. IIT JAM physics topic batch number 1 starting from tomorrow onwards. For that, you need to download the Unacademy application from Play Store and you can subscribe. Next, same time, there is another course, that is Tata Institute of Fundamental Research. That also chemistry batch also starting from tomorrow onwards. That batch is handled by chemistry batch is handled by Shikha Upadhyay madam, Anup Parali sir, Divya Agarwal, Anil Saini sir, Alka Rani madam. They will handle the chemistry topic for master stroke for TIFR course. TIFR exam is coming in March. So you will get a maximum 60 days. So you can join now and prepare very well. For physics batch, that is also for TIFR course, TIFR physics batch. That is starting from tomorrow, handled by Sunil Joshi sir, Amit Ranjan sir, Kajal Kumawat madam, Chandrasekhar Boj. And this all the details I have given to in my description box. You can check it and you can view their profiles also, your educator profile also. And if you are interested, you can join tomorrow onwards. Class batch is starting. Chemistry, physics for TIFR, chemistry, physics for IIT JAM. So best wishes. So we will go to our topic, that is pharmacology related respiratory system. First question, type of bronchodilator which stimulate the central nervous system and respiration, dilate coronary and pulmonary vessels, cause diuresis and relax smooth muscles. Type of bronchodilator which stimulate the central nervous system and respiration, dilate coronary and pulmonary vessels, cause diuresis and relax smooth muscles. Beta receptor antagonists, anticholinergics, Xanthine derivatives, sympathomimetics. First question answer. Now time is to start answering. Please start answering. Hi all. Jyoti, Shilna, Hafna, Ashok Panwar, Seema, Madhu. Please start answering. We started question. First question. Pharmacology may feel a little dry topic. If you are actively participating, we can make it very active sessions. Okay, we'll check the correct answer here. Correct answer for first question, that is option C, xanthine derivatives. Xanthine derivative will stimulate the central nervous system and respiration, dilate coronary and pulmonary vessels, cause diuresis and relax muscles, smooth muscles. Sympathomimetic bronchodilator dilate the airways of the respiratory tree, making air exchange and respiration easier for the client, and relax the smooth muscles of the bronchi. Sympathomimetic also, it is a bronchodilator which dilate the airways of the respiratory tree, making air exchange and respiration easier for the client and relax the smooth muscles of the bronchi. Due to bronchoconstriction only, patients will having breathing difficulty. So sympathomimetic also dilate the bronchi by relaxing the smooth muscles of the bronchi. Beta receptor agonist and anticholinergics are types of sympathomimetics. So these are the three options I have given other than xanthine derivatives. So sympathomimetic already explained. Beta receptor agonist and anticholinergics are examples of sympathomimetic bronchodilators. Next question. Bronchodilators are contraindicated in. Bronchodilators are contraindicated in COPD, peptic ulcer disease, anemia, hepatitis. Bronchodilators are contraindicated in. Think before answering. Bronchodilators mainly used in COPD. Okay, we'll check the answer here. Correct answer is option B, peptic ulcer disease. Mainly bronchodilators in the group of sympathomimetic bronchodilators that we cannot use in the case of peptic ulcer disease because it increases the gastric juice secretions. So gastric juice, that is HCl secretion, will increase. That will aggravate the peptic ulcer condition. That is why it is contraindicated in peptic ulcer. Bronchodilators increase gastric acid secretion, that is HCl secretions, and thus aggravates peptic ulcer. Next question. It is asked in previous video also. So if you are attended that video, means you can answer here. Therapeutic serum level of theophylline. Therapeutic serum level of theophylline 10 to 20 microgram per milliliter, 20 to 30 microgram per milliliter, 30 to 40 microgram per milliliter, 40 to 50 microgram per milliliter. Murugan, I am usually starting class evening 9 o'clock. So you can join 9 o'clock class. And tomorrow there will be two classes I am planning because I need to finish the pharmacology topic tomorrow. So most of you attended that previous video. That is, the correct answer. That is option A, 10 to 20 microgram per milliliter. Therapeutic serum theophylline level, 10 to 20 microgram per milliliter. Next question. Aminophylline is an example of. Aminophylline or theophylline is an example of beta receptor agonist, anticholinergic, xanthin derivative, none of the above. Fourth question. Aminophylline is an example of. Aminophylline or theophylline. Correct answer is aminophylline or theophylline is an example of xanthin derivatives. Xanthin derivative. Theophylline also is another example of xanthin derivative. Next question. Which among the following is sympathomimetic bronchodilator? Which among the following is sympathomimetic bronchodilator? Salmeterol, albuterol, epinephrine, all of the above. Salmeterol, albuterol, epinephrine, all of the above. Sympathomimetic bronchodilator. It will relax the smooth muscles of the bronchi. In this question, you cannot make a wrong answer. Correct answer is all of the above. Salmeterol, albuterol, epinephrine, all are the examples of sympathomimetic bronchodilator. Next question. Read question carefully. Beclometasone. Beclometasone is an example of corticosteroids, bronchodilator, anti-allergic, antitussive. Beclometasone. Betamethasone is different. Beclometasone is different. But still both are in corticosteroids. Example of betamethasone, beclometasone, all are examples of corticosteroids or glucocorticoids. Glucocorticoids or corticosteroids act as anti-inflammatory agents. So it will reduce the inflammations and reduce edema of the airway. In that way, it is reducing bronchial constrictions. Glucocorticoids, it reduces the inflammatory progress in the respiratory tract and reduces the edema of the respiratory tract. That is a function of glucocorticoids or corticosteroids. Next question. Which among the following is a Leukotriene modifier? Which among the following is a Leukotriene modifier? Salmeterol, ipratropium bromide or ipravent, aminophylline, montelukast. Only clue is there. One similarity is there. Example of Leukotriene modifier. So correct answer is montelukast. Here leuko, Here leucast. That is a similarity. Monteleucast is an example of Leukotriene modifier. Leukotriene modifiers are used in the prophylaxis. Prophylaxis means prevention, prophylaxis and treatment of chronic bronchial asthma. It inhibits bronchoconstrictions caused by specific antigen. So, leukotriene modifier specifically for antigen or allergic asthmatic conditions. So, it will reduce the bronchoconstrictions or it inhibits the bronchoconstrictions caused by specific antigens, reduce airway edema and smooth muscle constrictions. Leukotriene modifiers are used in the prophylaxis and treatment of chronic bronchial asthma, inhibit bronchoconstrictions caused by specific antigen, reduce airway edema, and smooth muscle constrictions. Next question, very easy question. Cetirizine hydrochloride is nasal decongestant, antihistamine, expectorant, steroid. Easy questions you need to answer fastly. So we can go to next questions. Please answer. Cetirizine hydrochloride. Action. Okay, everyone knows that is antihistamine. Cetirizine hydrochloride is antihistamine. Antihistamines are called histamine antagonists or H1 blockers. Antihistamines are called histamine antagonists or H1 blockers. These medications compete with histamine for receptor sites. It will not allow histamine to bind in receptor sites, thus preventing a histamine response. Histamine response means itching and mucus productions. So that will reduce. The antihistamines will not allow the histamine to attach the receptor sites. When H1 receptor is stimulated, the extravascular smooth muscles, including those lining the nasal cavity, are constricted. When H1 receptor is stimulated, the extravascular smooth muscles, including those linings of nasal cavity, are constricted. Antihistamines decrease nasopharyngeal secretions by blocking the H1 receptors, that is histamine receptors, and decreases nasal itching that causes sneezing. So this is the working of antihistamines. Action of antihistamines. Next question. Antihistamines should be used with caution in clients with which disease condition? Antihistamines should be used with caution in clients with which disease conditions? COPD, TB, common cold, urticaria. We can give antihistamine, but it should be used with caution. Antihistamine should be used with caution. Correct answer is COPD because it is reduces secretions, bronchial secretions. That is why it is used cautiously in the case of COPD. COPD, it will not allow secretion to cough out because it will causes drying of the secretions. That is why it should be used cautiously in the case of COPD patients. Antihistamines should be used with cautions in clients with chronic obstructive pulmonary disease because of their drying effect. It will dry the secretions and that time patient cannot cough out the secretions. That is why it should be used cautiously. Next question. Which drug stimulate the alpha adrenergic receptors, thus producing vasoconstrictions of capillaries within nasal mucosa? Which drug stimulate the alpha adrenergic receptors, thus producing vasoconstrictions of the capillaries within the nasal mucosa? Mucolytic agents, nasal decongestants, antihistamines, bronchodilators. Antihistamines we already discussed how it is working. Vasoconstriction in the capillaries of nasal mucosa will leads to reduce the nasal secretions. So usually this medicine is used in the running nose conditions. Correct answer is nasal decongestants. Nasal decongestants, that is alpha adrenergic receptors, that stimulates the alpha adrenergic receptors and produce vasoconstrictions of capillaries within the nasal mucosa and reduces the mucus productions. That is the action of nasal decongestants. One of the example that is Otrivin. Otrivin main ingredient is oxymetazoline is an example of nasal decongestants. Adult one Otrivin, that is main ingredient, that is oxymetazoline, is an example of nasal decongestants that will stimulate the alpha receptors of the nasal mucosa and constricts the capillaries. Next question. Frequent use of decongestants, especially nasal sprays or drops, can result in. Frequent use of nasal decongestants, especially nasal sprays or drops, can result in tolerance and rebound nasal congestion, nervousness and restlessness, hypertension and hyperglycemia, all of the above. Side effects of long-term use of nasal decongestants. Okay, we'll check the correct answer here. So correct answer is all of the above. Long-term use of nasal decongestants will leads to tolerance and rebound nasal congestions. Rebound nasal congestion means it will increases the nasal congestion. We are using the nasal decongestion for reducing the nasal congestion, but due to the long-term use, rebound nasal congestion will be there. That means nasal congestion will increase, and nervousness and restlessness also will be there. Hypertension and hyperglycemia also will be there. We'll check the reason. All mentioned options are side effects of nasal decongestion. Frequent use of decongestants, especially nasal sprays or drops, can result in tolerance and rebound nasal congestions because of vasodilations. Usually, due to the stimulation of adrenergic receptors in the mucosa in the nasal cavity, vasoconstrictions will be there. So, because of long-term use, it will again causes vasodilation. It is caused by irritation of the nasal mucosa. Decongestants relieve nasal stiffness by narrowing blood vessels and reducing swelling in the nose. This narrowing can affect other blood vessels. So systemic, usually we are giving for local effects, but due to the long-term effects, the Vasoconstrictions will go into the systemic circulation, that is systemic uh, blood vessels. That also will leads to vasoconstrictions. At that time, blood pressure increases. Narrowing can affect other blood vessels as well, which can increase blood pressure. Oral decongestants. Usually we are not using now. Oral decongestants. Examples: pseudoephedrine, phenylephrine, phenylpropanaloamine can increase both blood glucose and blood pressures, and therefore are not usually recommended. Nowadays, oral decongestant, nobody is writing prescriptions. So, prolonged use of oral decongestant, nasal decongestant will leads to some side effects like rebound congestions, hypertension, hyperglycemia, confusion, restlessness, etc. Next question. Which drug breaks down the chemical structure of mucous molecules? Which drug breaks down the chemical structure of mucous molecules? Acetylcysteine, guaifenesin, oxymetazoline, cetirizine. Okay, small clue for you. That is trade name for that medicine. That is Mucomix. Trade name. Be familiar with that trade name. That is Mucomix. Jinsha Wilson. You are correct. Okay. Acetylcysteine. Acetylcysteine will break down the chemical structure of mucous molecules, and it increases the viscosity. It reduces the viscosity, and mucus will be thin. That is the action of acetylcysteine. It is an example of mucolytic. So commonly, this is available in our ICUs and emergencies area. To before suctioning, we will instill a mucomix to make the secretion thinner. Mucomix or acetylcysteine is a mucolytic agent. It breaks down the chemical structure of mucous molecules, and thus mucus become thinner and can be removed more easily through cuffing or through suctioning. Next question, 13th question. Dash are used for dry, unproductive cough and to stimulate bronchial secretions. Dash are used for dry, unproductive cough and to stimulate bronchial secretions. Mucolytic, expectorants, antitussives, nasal decongestants. Direct question. Dash are used for dry, unproductive cough and to stimulate bronchial secretions. Direct question. Mucolytic we already discussed it. Nasal decongestants we discussed it. So only two left. Correct answer is expectorants. Expectorants means it is to increase the mucous secretions. It is used to increase the mucous secretions. So when dry unproductive cough, unproductive means the sputum is not coming, but cough is there. In that case, we can stimulate the coughing, stimulate the secretions, bronchial secretions by giving expectorants. Antitussive we will discuss in another questions. Mucolytic we already discussed. It helps to break down the thicker mucus molecules to thinner. Nasal decongestants we already discussed. It stimulates the alpha receptors in the nasal mucosa and it reduces the nasal mucus secretions. Expectorants are used for dry unproductive cough and to stimulate bronchial secretions. Expectorants reduce the thickness or viscosity of the bronchial secretions, thus increasing the mucus flow that can be removed more easily through coughing. Guaifenesin is an example of expectorants. So those who are given a B option also, it is correct only because guaifenesin is an example of guaifenesin is also an example of expectorant. Next question. Dash act on the cough control center in the medulla to suppress the cough reflex and are used for a cough that is non-productive and irritating. Dash act on the cough control center in the medulla to suppress the cough reflex and are used for a cough that is non-productive and irritating. Mucolytic, expectorants, antitussives, nasal decongestants. Already explained about all three. So only one is left here, that is antitussive. So correct answer is option C, antitussives. Antitussives used to suppress the cough reflex by acting on the cough control center in the medulla. Antitussives used to suppress the cough reflex. So usually the cough that is non-productive and irritating. In that condition, we can suppress the cough reflex. But any infections causing cough, that is a dry cough, then that time we will stimulate the bronchial secretions. Otherwise, due to cough is due to any allergic conditions or any other reasons. So in that condition, we will give cough suppressants to uh, reduce the coughing reflex. But in the infection condition, we will not give antitussives. So in infection condition, respiratory infection condition, we need to remove the bronchial secretions. In that condition, we will give expectorants. Due to the cough is due to any other irritations or any other problem, we will give antitussives if it is irritating. Two types of antitussives are there. One is narcotic antitussives, examples codeine sulfate, and non-narcotic antitussives, example dextromethorphan and diphenhydramine. These are the examples of non-narcotic antitussives. Narcotic antitussives used for it will cause addictions. So some of the persons will use the narcotic antitussives for long term to get the addictions. So that is a very serious case. Narcotic antitussives will cause addictions. That is why nowadays doctors are prescribing non-narcotic antitussives. Next question. Which among the following is a narcotic antagonist? Which among the following is a narcotic antagonist? Naltrexone, naloxone, both of the above, none of the above. Easy question. Narcotic antagonist or narcotic poisoning antidote. Options are I made it for making confusion only, but correct answer is option B, that is naloxone. Narcotic antagonist example, that is naloxone. It is used for morphine or other narcotic drug poisoning or overdose. A narcotic antagonist reverses respiratory depression in narcotic overdose. Example, morphine overdose or morphine toxicity. Naltrexone is a anti-addiction medicine. Naltrexone is an anti-addiction medicine. Naloxone is a narcotic antidote. Next question. Which among the following inhalers is not supposed to be put in mouth? Which among the following inhalers is not supposed to be put in mouth? Inhaler with spacer device, metered aerosol inhaler or MDI, dry powder inhaler, soft mist inhaler. Which among the inhaler is not supposed to be put in the mouth? Okay, we'll check the correct answer. Actually, it is a debatable question. Correct answer is metered aerosol inhaler or MDI, metered dose inhaler. Sometimes it is also known as metered aerosol inhaler. Why it is telling means, so usually the metered dose inhaler used with spacer device. So we can avoid direct contact with the medicines. The oral cavities will not directly exposed to the medicines. In the case of corticosteroid or steroid medication inhaler, it will deposit in the oral cavity when we are not used with the spacer device. So we will directly insert the meter dose, means that will some medications, very small amount of medications will deposit in the oral cavity and which leads to oral thrush if we are not taking oral wash after inhalation. So that is the side effects of the metered aerosol directly using with directly inserting into the mouth. To prevent that, we will tell the patients to use it with 1 to 1.5 inch in front of the mouth, and we need to use the inhaler. So that will reduce the direct deposit of the corticosteroids or medicine into the oral cavity. But in the same time, salbutamol like inhaler, MDA inhaler, doctors sometimes tell to they can use with the directly insert into the mouth, but only in the case of corticosteroid. Steroid type medications should not insert into the mouth. Metered dose inhalers should not be put in mouth but held about 2 fingers width, that is 1.5 inches in front of the mouth. Next question. A newer type of inhaler that gives a pre-measured amount of medicine in a slow moving mist. A newer type of inhaler that gives a pre-measured amount of medicines in a slow moving mist is soft mist inhaler, dry powder inhaler, pressurized metered dose inhaler, all of the above. A newer type of inhaler that gives a pre-measured amount of medicine in a slow moving mist. It is introducing Correct answer is soft mist inhaler. Soft mist inhaler, it is introducing nowadays, and it is usually, I will show you an example. This is an example of slow mist inhaler, that is the use directly we can use to insert into the mouth and we can use. So it will produce slow inhalation of the mist. It's a newer type of inhaler that gives a pre-measured amount of medicine in a slow moving mist. So after inserting and pressing the button, we need to take breathe through mouth. So it will come inside. The mist helps you inhale the medicine. A dry powder inhaler, that is another one. A dry powder inhaler is a device that delivers medication into the lungs in the form of dry powder. A dry powder inhaler is a device that delivers medication to the lungs in the form of dry powder. Next question. How much time should a patient be instructed to hold the breath before breathing out after the activating inhaler? 5 seconds, 10 to 15 seconds, 15 to 20 seconds, 3 seconds. How much time should a patient be instructed to hold the breath before breathing out after activating inhaler? Ashok Panwar, it is a plastic type. Okay, we'll check the correct answer here. So most of you given correct only. That is option B, 10 to 15 seconds. So after pumping that MDI inhaler, we need to instruct the clients to hold the breath for 10 to 15 seconds. Maximum 15 seconds. Usually we will tell to count 10 seconds. To count 10, then they will patient can exhale. That is also very slowly. So usually patient need to hold the breath for 10 to 15 seconds. After activating the inhaler, the patient should continue breathing in for about 5 seconds. After the activating the inhaler, patient need to take breath for 5 seconds. That is slow breathe. Then hold the breath for 10 to 15 seconds. Then slowly exhales. That is the procedure of administering MDI or inhaler. Patient then hold the breath for 10 to 15 seconds before breathing out slowly. Next question. Time required to wait for taking a second dose of inhaler after the first dose is. Time required to wait for taking a second dose of inhaler after the first dose is 5 minutes, 10 minutes, 1 to 2 minutes, 10 to 15 minutes. If there is two inhaler, so what is the interval between first one to second? If there is a two inhaler prescribed by doctor, what is the time interval between two inhaler? Okay, we'll check the correct answer here. That is option C, 1 to 2 minutes. So we need to keep 1 to 2 minutes interval between two inhaler. If a second dose is needed, the patient should wait 1 to 2 minutes before taking another dose. Next question. A patient was prescribed a bronchodilator inhaler and a glucocorticoid inhaler. A patient was prescribed two inhaler here, bronchodilator inhaler and glucocorticoid inhaler. What is the order of using inhaler in this patient? So what is the order of using inhaler in this patient? Glucocorticoid first, followed by bronchodilator. Bronchodilator followed by glucocorticoids. Both together. Can use anyone first. Question number 20. Questions are may feel easy, but answers are confusing. Okay, we'll check the correct answer. This is important question only. Next time, don't make mistakes. Those who are given wrong answers, I think most of you given correct only. First one, bronchodilator. Then glucocorticoids. Option B, bronchodilator first, then glucocorticoids. If two different inhaled medications are prescribed and one of the medications contains a glucocorticoids or corticosteroid, administer the bronchodilator first and the corticosteroid second. Wait 5 minutes following the bronchodilator before inhaling the corticosteroids. So before giving glucocorticoids, we need to wait 5 minutes here. So next time, don't make any mistakes. It is a very important question. So that is about today's video. So thank you for joining with me. Tomorrow we will discuss about cardiovascular system pharmacological questions, and one more video is there related to pharmacology. So both we will discuss tomorrow. So I will schedule like 4 o'clock one video and 9 o'clock another video tomorrow, Monday. So all of you please join in both sessions, 4 o'clock and 9 o'clock. So I will keep you informed in our community post. So all of you please keep in touch, and if you are interested, you can share with your friends, and you can bring them also in our live sessions. I know pharmacology is a little dry topic, but it is also important. We'll ask questions from pharmacology. Ashok Panwar, image-based questions also will make. Don't worry. So that is why while explaining some questions, I am giving some images so you can easily understand. So that will help you in image-based questions also. So please watch all the videos completely, and pharmacology questions are important. Those who are studying in nursing college or nursing school, they can also attend, because pharmacology is one of the important topic. Okay, good night. Please stay tuned tomorrow. Two videos are planning related to pharmacology.